Serenity is an NHS service that supports individuals who have been raped or sexually assaulted. Serenity will offer individuals and their family practical help and emotional support, including what they want to do next, and support them in their choices. Serenity covers all of Northamptonshire for forensic examinations and emotional support for both adults and children. Referrals into Serenity. Most of our referrals will come via police, so the police will directly make a referral to Serenity. We do take self-referral patients 16 years and upwards, so these are individuals who do not want to report to the police at the point of calling. They will call our 24-hour helpline number and speak to a crisis worker who will ascertain the client needs. For self-referrals, the crisis worker will have to speak to the patient directly to ensure the correct information is obtained. It's important to note that for self-referrals, we can only take 16 years and over without police involvement. However, a mass referral will have to be made for all 16 and 17-year-olds due to safeguarding and public safety concerns. For all of our adult referrals, we also ensure we inform them that we would have to report any safeguarding or public safety concerns. The crisis worker will take the initial information for all referrals, which includes name, date of birth and address, and phone number of the patient, date and time of the assault, the details of the assault to inform us what the forensic window time frame is, and for medication, a risk assessment for medication, injuries, forensic evidence and possible safeguarding. The crisis worker will then arrange a time for the examination along with the doctor, or we can signpost to any appropriate services if the client declines to attend or does not meet our criteria. Ringing Serenity from the hospital for self-referrals. So staff members can ring our 24-hour helpline directly and discuss any concerns with our crisis workers. You will also be able to be put through to our forensic physician if required. If an exam is appropriate, the crisis worker will want to speak to the patient directly to confirm the details and obtain consent for forensic examination. After this, the crisis worker will liaise directly with the patient and/or hospital staff to facilitate an appointment. Serenity is accessible 24 hours a day, but staff are not based at the unit out of hours, so any appointments have to be pre-booked via our crisis worker. Please note that Serenity does not operate as a drop-in service. Signposting. When a patient attends for a forensic medical, a referral is made to sexual health with patient consent. This is usually done at NGH or Ashwood. The GP is also made aware of their patient's attendance if the patient also consents. We regularly signpost to Rape Crisis and Voice if the patient does not meet our criteria. Serenity also provides an ISVA service, which is an independent sexual violence advisor who will work with patients from report to court. The criteria for emotional support is self-referrals, a penetrative assault within the last 6 months, or any historical incidences being investigated by police. Asking questions. What should you be asking the patient? You want to know the basic details of what happened, who the possible perpetrator is, when the assault happened and what happened. Is the perpetrator their partner? Have you considered a referral to Sunflower Centre? Is the number they provided safe to be contacted on? Are there children who may be at risk? Is the victim a child themselves? Have you considered a MASH referral? You do not have to go into detail at this stage, but encourage the patient to call us or the police. The most important thing is to listen and make them feel believed. Do not be afraid to ask questions. Forensic timeframes. It is important for us to see a patient as soon as possible to maximise our chances to collect forensic evidence. Encourage the patient not to wash, have a shower or bath, and keep hold of their clothing. Physical health will always take precedence over forensics, and medical needs should firstly be met. For example, if the patient requires bloods to be taken, this is not going to affect any forensic evidence recovered. Please see the table for forensic evidence timeframes. Thank you for listening, and please feel free to contact us if you need any more information.